What is diabetes? Diabetes is a disease that occurs when your blood glucose is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin is a hormone that is made by the pancreas that helps glucose from food get into your cells to be used for energy. Sometimes your body does not make enough or any insulin or does not use insulin very well. Different types of diabetes. Type 1 diabetes occurs when your immune system, the body system, is fighting for infection, attacks and destroys the insulin producing beta cells called pancreas. Type 2 diabetes, most common form of diabetes, caused by several factors, including lifestyle factors and genes. Gestational diabetes, a type of diabetes that develops during pregnancy, is caused by the hormonal changes of pregnancy women along with genetic and lifestyle factors. Symptoms and causes: increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, and unexplained weight loss. Risk factors for type 2 diabetes. Your chances of developing type 2 diabetes depend on a combination of risk factors such as your genes and lifestyle. Although you can't change risk factors such as family history, age, or ethnicity, you can change lifestyle risk factors around eating, physical activity, and weight. These lifestyle changes can affect your chances of developing type 2 diabetes. Risk factors for type 2 diabetes are overweight or obese, are age 45 or older, family history of diabetes, high blood pressure, low level of HDL, which is good cholesterol, or high level of triglycerides, not physically active, depression, history of heart disease or stroke. Preventing type 2 diabetes. Diabetes can cause serious health problems such as heart disease, stroke, and eye and foot problems. Prediabetes also can cause health problems. The good news is that type 2 diabetes can be delayed or even prevented. The longer you have diabetes, the more likely you are to develop health problems, so delaying diabetes by even a few years will benefit your health. Ways to prevent type 2 diabetes: lose weight and keep it off, move more, eat healthy foods most of the time. Diabetes test and diagnosis. Your healthcare professional can diagnose diabetes. The blood test shows if your blood glucose, also called blood sugar, is too high. Anyone who has symptoms of diabetes should be tested for the disease. Some people will not have any symptoms but may have risk factors of diabetes and need to be tested. Testing allows healthcare professionals to find diabetes sooner and work with their patients to manage diabetes and prevent complications. Testing also allows healthcare professionals to find prediabetes. Making lifestyle changes to lose a modest amount of weight if you are overweight may help you delay or prevent type 2 diabetes.
Treatment for all types of diabetes. Fruits, vegetables, and whole grains can help diabetes. Eating foods that are high in fiber, nutrition, and low in fat and calories, as well as cholesterol, is the best eating plan in treating all types of diabetes. Eliminating refined sugars and carbs is also extremely important. Physical activity is vital in treating diabetes. Exercise lowers blood sugar level by moving sugar into cells where it is used for energy, and also increases sensitivity to insulin, which reduces the body's need to insulin in order to transport sugar to cells. Smoking and diabetes. Smoking can cause type 2 diabetes. Smokers are 30 to 40% more likely to develop type 2 diabetes than non smokers. People with diabetes who smoke are more likely than non-smokers to have trouble with insulin dosing and controlling the disease. Risk factors are heart attack, stroke, nerve disease, kidney disease, diabetic eye disease, and amputation. Treatment for type 1 and type 2 diabetes. If you have type 1 diabetes, you will use insulin injections, insulin pumps, frequent blood sugar checks, and carbohydrate counting. If you have type 2 diabetes, your treatment primarily involves monitoring blood sugar along with diabetes medications or insulin. You can control type 2 diabetes with healthy diet and regular exercise. Monitoring blood sugar. Constantly checking blood sugar is recommended for people with diabetes. Careful monitoring is the only way to make sure blood sugar level remains within target range. Recommended target for blood glucose levels are 80 to 130 milligram deciliter before a meal and less than 180 milligram deciliter about 2 hours after a meal. Blood sugar level can change accordingly to food, physical activity, medications, illness, alcohol, stress, and sometimes hormone levels. Insulin. People with type 1 need insulin to survive. Some with type 2 diabetes and gestational diabetes need insulin as well. There are rapid acting, long lasting, and intermediate insulin options. Insulin can't be orally ingested to lower blood sugar because it reacts with stomach enzymes. Insulin is often injected or come in pump forms. Oral or other diabetic medications. There are different types of diabetic medications. Some stimulate the pancreas to produce and release more insulin. Others inhibit the production and release of glucose from the liver to decrease the need of insulin to transport sugar into the cells. There are also medications that block the actions of stomach enzymes to break down sugar. Treatment for gestational diabetes. It is important to control blood sugar level during pregnancy to keep baby healthy and to avoid complications during delivery. The important steps are to maintain a healthy diet, to exercise, and in some cases taking oral medications or using insulin injections.